Good afternoon. My name is Rachel, and I will be your conference operator today. At this time, I would like to welcome everyone to the NCCOR Connect and Explore conference call. All lines have been placed on mute to prevent any background noise. If you should need assistance during the call, please press *0 on your telephone keypad, and an operator will come back to assist you. Thank you. Elaine Arkin, you may begin your conference.
Thank you, Rachel, and welcome everyone to today's call. We're glad to have you join us on this beautiful summer day. Today's program will feature two spotlight segments. The first is on evaluating community health care engagement models in obesity prevention. The second will look at the power of healthy communities, a clinic-community collaboration. And then after this main feature, we'll have a one-on-one segment where you can ask our presenters questions. And finally, we'll discuss what's next for NCCOR, including a new tool, the SNAP-Ed Evaluation Framework, and Interpretive Guide. Now, just before we get started, if you have a question for our speakers during the presentation, and we encourage you to ask them questions, please don't hesitate to write it in the chat box on the left side of your screen. Also, if you need technical assistance, as Rachel said, please let us know using the same chat box. If you're having trouble logging onto the webinar but can hear us on the phone, you can email us at NCCOR, NCCOR, at FHI360.org, and we'll work with you to resolve the problem and get you on the webinar. And finally, one more important note. If you've decided to listen to our webinar today using your computer speakers, and we see that a lot of you are doing that, please turn down or mute your computer microphone. This will greatly reduce the potential for background noise, including the barking dogs that we sometimes hear. So thanks so much for that. And one more thing, we'll also be live tweeting during today's webinar. So if you're on Twitter or on other social media, we encourage you to join the conversation by using the hashtag ConnectExplore and following the Twitter handle at NCCOR. We'd love to see you there. Now, our speakers today are Darcy Freedman, Elsa Keeler, and Marna Canterbury. Darcy is an associate professor of epidemiology, biostatistics, and social work at Case Western Reserve University. She's the associate director of the Prevention Research Center for Healthy Neighborhoods, and she's the director of the Ohio Building Capacity for Obesity Prevention Research Network. Elsa is a pediatric physician with HealthPartners. HealthPartners is an integrated healthcare organization providing healthcare services and health plan financing and administration. And finally, Marna is the director of community health at the Lakeview Health Foundation in Minnesota, which is a part of HealthPartners. Now, I'd like to turn it over to Darcy for a spotlight segment on evaluating community healthcare engagement models in obesity prevention. Darcy?
Thank you, Elaine, and thank you to the NCCOR team for giving me the chance to be here today. I am presenting on work in South Carolina. However, I want to give a quick shout out to the Cleveland Cavaliers who are marching through our town right now, celebrating the championship for the NBA. So I'm going to be presenting on a specific community clinical partnership model that was developed through the Right Choice Fresh Start Farmers Market. And on this slide, you can get a feel for that farmers market. It's located in a rural community in South Carolina. And the one picture here on the left is, to me, the one that captures the essence of the market to its greatest extent. So this is a market model that was developed specifically for people who are patients at a federally qualified health center, but also targeting people of not necessarily patients, but people in the community who could benefit from the farmers market. Just to begin, I did want to acknowledge that the research I'm presenting on today was funded by the CDC through two different grants, one to the University of South Carolina Prevention Research Center, and also through support from the Prevention Research Center for Healthy Neighborhoods at Case Western Reserve University. I do not have any conflicts of interest related to this work. I also want to acknowledge...
I apologize. We're having trouble with the advance, so I'm sorry, Darcy. If there's anything, Karen, that we can fix, that would be great.
Okay. In terms of this type of work, so community clinical work, it's important to acknowledge that this is not the work of one person by themselves. It's team-based work, it's cross-sector work, and so, it's important to acknowledge that a number of partners are involved and continue to be involved in the Right Choice Fresh Start Farmers Market at Family Health Centers, Inc., the Farmers Market itself, South Carolina Primary Health Care Association, and the University of South Carolina Cancer Prevention and Control Research Network. So what is the Right Choice Fresh Start Farmers Market model? This is a farmers market located at a federally qualified health center in Orangeburg, South Carolina. So if you're looking at this map, Orangeburg is in the middle of the state. It's just south of Columbia, and many of you are probably familiar with Charleston, so it's a little bit north of Charleston. Federally qualified health centers are numerous across the country. So when we developed this model, we thought about scalability. In the United States, there's over 9,100 service delivery sites for FQHCs, also called community health centers. And in the state of South Carolina, there's over 160. These health centers are designed to serve underserved populations by providing comprehensive preventive health care. The farmers market model started in 2010 through a community university partnership, and I'm very happy to say as of June 3rd of this year, the farmers market opened for its 6th season. A little bit about the context. Orangeburg is a micropolitan area. It's majority African American, so about 2/3 of the residents are African American. The median household income is less than the median household income for the state, and it's an area with very high rates of obesity and diabetes. Specifically at the health center in 2009, so that was based on our beginning year in 2010, more than 25,000 patients went to Family Health Centers, Inc. And the farmers market was developed through a community university partnership that had 3 primary goals, and these were actually developed through a community visioning meeting. One of them being to increase access to produce among patients at the community health center. Secondly, to improve diet among adults and children in the community. And then thirdly, and I think this is probably a unique goal for a health center, is to think about the broader implications of this and broader influences on health. And so they had a goal also around increasing demand for local farmers market products and ultimately for economic opportunity. I think it's important to note that the very first vendor who signed up to become a farmer at this market was responded to an advertisement in a local newspaper, and he was interested in becoming a vendor because he is also a patient at the health center. In terms of some successes and opportunities, first, a successful strategy employed was that of engaging the community, and I think that's a real focus in our presentation today. You can see along this chart here, there were numerous opportunities to engage the community through very formal strategies such as establishing memorandums of agreement, through community vision meetings to identify the goal, formation of an advisory council, and hiring local people to become managers at the market, and ongoing processes for getting feedback from customers, from farmers, as well as social events in the market space. Finally, you can see on this slide, we engaged the community in terms of thinking about further funding to sustain the market model. And while the first grant was written by the university in collaboration with the site, all future funding, and there have been numerous grants awarded to this project, were awarded directly to the health center. A second successful strategy was the use of a multi-component framework to guide the intervention development. Specifically, we used a multi-component nutritious food access framework that looks at 5 domains relevant to food access around economic, service delivery, spatial, temporal, social, and personal. And so, for example, in the economic domain, there were intervention components such as accepting SNAP at the market, having fair market prices, and offering financial incentive programs. And I'm going to talk a bit in a minute about the incentive programs. Around spatial temporal, for example, obviously we located the market in a space that would be easily accessible to the patients, but also to nearby residents. The market directly behind it was Section 8 housing, and we were on a bus line. Another example of the collaborative model of the project, the health center did some construction work to build curb cuts so that the market space would be handicap accessible. A third successful strategy is our focus on systems change. And so you can see in this slide here, this is probably something many of you are familiar with around an ecological model of multiple influences on health. And importantly, in our project, we thought of these not as discrete units, but rather as interconnected. So for example, the intervention of the health center-based market was sort of a community-level intervention, but we thought that this type of intervention is only going to be successful when we begin to shift relationships and organizational structures that potentially influence individual-level behaviors. So one example of that was the development of a produce prescription program where providers would be shifting patient-provider communication behaviors, recommending use of the farmers market by their patients, and importantly, patients were then able to see their providers at the farmers market, outside of the four walls of the clinic, and engage in new kinds of communication, not only verbal, but also role play, and seeing their providers actually purchase the things that were just recommended right inside the clinic. I did want to make one note about, obviously there's always things you can learn in these projects. One of our key lessons was around times when researchers were perhaps more engaged in innovating change rather than empowering the community health center to lead change. And just as one example, I mentioned the produce prescription program. There ultimately were two produce prescription programs in the project. One of them was developed by the health center, and that ended up becoming linked to a diabetes self-management program. The person who offered that program changed how they were scheduling delivery of the curriculum, so it was on Friday. People could come to the training and then go right out and shop at the market. And that prescription program ended up becoming more successful than the one that was more researcher developed. And so I included this quote here by one of our advisory council members and farmers market vendors, and his point that you really do want to keep it simple and finding ways that the community can maintain as you move forward. In terms of evaluation, we have a number of different ways we've evaluated this project over about 7 years, and I'm just going to give you highlights in a couple of areas. At the end of my slides today, I do have a list of references related to papers emerging from this project. So key question in community-level population health research and practice is thinking about the reach. So who's actually coming to the market? One of the ways that we looked at reach was enrollment in the Healthy Food Incentive Program that we called Shop and Save. And of the 336 people that enrolled during the first year, about half were patients at the health center, about half were receiving SNAP, and about 40% were families with children in the household. And you can see rates of diabetes and high blood pressure are very high among enrollees. So we really felt like we were reaching a key population. Another way we looked at evaluating the project was to calculate the benefit of having the Healthy Food Incentive Program in terms of opportunities to increase consumption of fruits and vegetables. And what we found is that through this incentive program, there was a 52% extension of food assistance dollars, which meant that instead of being able to buy 9 products at the farmer's market for $5, a person would be able to get 15 products with the incentive. Other indicators of success and sustainability include additional evaluation we've done, continuing to track sales at the farmer's market. So for example, last year there were over 1,100 SNAP purchases made at this farmer's market with an average of about 55 transactions per week. and about 1,400 people receiving healthy food incentives. A question we get asked a lot is, well, what's the relationship or what's the level of dose of the intervention, in this case a farmer's market, that produces the greatest effect? We have a paper where we looked at the influence of increased use of the farmer's market on increasing fruit and vegetable consumption among patients with diabetes, and we found that those who went to the market more often had significantly greater odds of improving their fruit and vegetable consumption. And then finally, I included this slide around some methods that we are doing to make evaluation a little bit more user-friendly. And so this is an example of just a rapid appraisal method, dot surveys that are put up in a tent at the market on, once a month to get feedback about questions that the advisory council wants to learn more about. In terms of looking ahead, a couple of things that we've done in terms of replicability. We have developed a YouTube video that I highly recommend watching to learn more about the process. We also developed a manual describing the community engaged model for building the farmers market at a community health center. And we were able to translate some of the success of the farmers market project to inform policy, not only in South Carolina, but also at the federal level with the Food Insecurity Nutrition Incentive Program that I could talk more about during the Q&A. And then lastly, I wanted to mention that we do have, we've now established through a new project, a tracking system that assists farmers markets across the country in terms of their recording of information related to healthy food incentive program delivery and overall evaluation. And this tool called FM Tracks is now being recommended as a part of the SNAP-Ed interpretive guide that Elaine is going to mention toward the end of the talk today. Here's a list of the papers related to our project, and I'd be happy to share any of these with you if you're not able to access them. And with that, I'll turn it over to the next presenters.
Thank you so much, Darcy. That was just wonderful. And to everyone who's participating in the webinar today, a reminder, it will be available online on the NCCOR website. And so if you want to share these slides in the webinar with peers or have access to the resources that Darcy has mentioned, you'll be able to do that there. Now, as a reminder, if you have a question for Darcy, we will have a time to ask questions of our presenters today. And you can, at any time, type in your question in the chat box. And when we get to that period, we'll be able to ask it. So on to our next speakers, Elsa and Marna, to talk with us about the power of healthy communities, and especially a clinic community collaboration.
Thank you so much, Elaine, and thank you, Darcy, for that great review of your work. I think as you were talking about the words community engagement and the importance of having the community at the table as a shared partner in this work, I think you'll hear both Dr. Keeler and I echo that same experience with the work we're going to describe to you today. Could someone advance the slide, please?
Sure.
I seem to have lost the ability, so. Okay, so I am looking at the overview of the Community Initiatives Framework, which really guides the work that we do. If we could go back one slide, please, that would be super helpful. Thank you. And that framework is really how we think about our work under two names of community initiatives, Power Up and BearPower. Both share a purpose statement, which was developed in partnership with the community. Community-based initiatives to make better eating and physical activity easy, fun, and popular so that youth can reach their full potential. And for our community advisors and partners, those words were very important. The focus on children, the focus on a positive approach within our community, and shared leadership really being the heart of the work with these specific communities. As you can see from the map, the 7 communities where this work is focused span 2 states Minnesota and Wisconsin, and also 4 counties and 7 communities. The focus is on long-term community change, and so partners and advisors, as well as the work and the funding for the work, really is a long-term commitment that also falls under our health system's community health needs assessment plans and is supported then by both health partners as well as local hospital foundations. Next slide, please. The Community Initiatives Framework was also developed by the community in partnership, and it really is a simplified way to look at how we approach this work together. The 4 levels of the pyramid aren't meant to illustrate importance of the work, but rather the size of each of those levels, environment, engagement, programs, and clinical interventions, are meant to reflect the potential reach of each of those types of strategies. You'll also notice that the framework sits within the community, as opposed to this being an initiative that we bring to a community, again, reflecting the shared leadership model of creating this work. The 4 levels are considered a multi-level approach, where really environmental change, engaging the community, specific programs, and of course our clinical partners are meant to be used simultaneously in a community. We'll tell you a little bit later more very specific examples of how this work shows up. But as an example of environmental change, that includes policies and systems and environmental changes, such as the change in a school wellness policy. The green zone of engaging the community really reflects the intentionality about having leadership at the table. Our committees and advisory groups for both BearPower and PowerUp reflect some internal experts, doctors, interdisciplinary team members, but also the majority are community members, business owners, restaurant owners, school personnel, a local YMCA, a grocer, any person who's interested in joining this shared effort. Programs include things like our School Challenge program, which is a 3-week school-based program, helping children track fruits and vegetables right there in the classroom. And Dr. Keeler will expand more on the clinical intervention. Next slide, please. As we think about the work we do in the community, we're also keenly aware of where we fit along an engagement of community engagement. And this continuum on the top is really from the Centers for Disease Control model of community engagement. So if you think about far over on the left, those are the pieces that we do that really are outreach, whether it's showing up at a community event or whether it's really finding other ways to keep the community informed. And while that's a very important part of the work, we really strive to move as far to the right on this diagram as possible, where really the leaders in the community are joining the effort, they're sharing with us, and that this work continues what we call contagious change. I'll give you an example. When you have a school board member or a local parent that's really involved in leading the work, sometimes PowerUp and BearPower may hear about the great work that's going on just spontaneously when a local business leader decides to power up the food on their menu, or when someone else joins the effort without it being programmatized or created from some central place. In addition, the second line, the gray line that indicates phases, is what our learning has been, that communities are at different places in different phases in their interest and readiness to move fully into PowerUp or BearPower. And we've learned that each community is so different. So we've found a way to evaluate each of our 7 communities in terms of where are they in this process. And we're learning what are the essential components to help a community embrace and all of us work together towards a shared goal, and what are some of those things that get in the way. As Dr. Keeler speaks later, she'll be focusing her comments on the White Bear Lake community, primarily under BearPower. And they, on this diagram, are really a phase 4 community They have a high degree of community leadership at the table and have from the beginning. You'll hear that reflected in her comments. While there's a lot of great work happening in all of our communities, we really think of it all as co-creating community change. These are just some of the highlights of that work. Because we focus on children, of course, schools are an important partner and an important channel in this work. I mentioned the School Challenge program earlier, and that work also translates into strong school relationships where we have a school change toolkit as well as an evaluation survey where we can track the change in school environment over time. That has translated into one of our districts into school wellness policy change. Just 2 weeks ago, one of our key communities in Stillwater, Minnesota, the school board passed a very strong school wellness policy. That was work that we have done together, side by side, over the last 2 years. And to have the board embrace that vision and implement it in this district is a sign of how we're going to sustain this change over time. While there are many other important programs, I just want to highlight the open gyms and pools, which are happening in partnership with schools or with YMCAs that already have gym space, opening those up free or at low cost to communities throughout our region of target. And in addition, in Minnesota and Wisconsin, we have long, cold weather months, and it's very important to have free and low-cost spaces open during those months, and that's really been a successful strategy. While we also work with farmers markets and have a great project in the food shelf, I want to make sure that we have enough time to really talk in detail about the important work that's going on in partnership with our clinics. And so I'm going to turn it over to Dr. Keeler, who's going to describe some of those pieces there.
Thank you, Marna, and thank you, Elaine. I'm going to advance here. I'm going to speak to 3 BearPower initiatives that the clinic partnered in as part of BearPower. The first is the Fruit and Veggie Rx, which started as a pilot in 2014 between a local grocer and HealthPartners White Bear Lake and Hugo clinics, as both of these clinics serve many of the children within the reach of BearPower. This grocer had already partnered with us to make changes in their organization that might promote wellness around eating. And it was a way for us at the clinic to carry the message of wellness choices across from school to home to clinic and then to link the parents in. This RX is not about lowering the cost of food. It is about a conversation. It is a simple tool that might empower families to choose foods that promote well-being. So when I see children in routine health preventative care visits, I would ask parents if they were happy with the amount of fruits and vegetables their child ate. And if they were not, we would have a conversation and we would prescribe the RX. We issued 177 RXs during the pilot phase, with close to 30% of them being redeemed. In 2015, the RX was expanded to additional clinics in the HealthPartners system. And I want to highlight the Hugo Clinic, which continued to participate in that year, handing out 250 prescriptions with a close to 50% redemption rate. I believe that that is a result of the collaboration between the local grocer, which is actually located in very close proximity to the clinic. What I found from this RX is that it is a dual prescriptive. That is, both the parent guardian and the child, who is my patient, is involved in the process. I have very long-term relationships with the patients in my clinic, and it enabled us to take our conversation around eating well to a new level. It allowed for a conversation that actually could leave the clinic in a very tangible way. And I also found it supported engagement with the local grocer around their messages to the consumers in our community. So for 2016, this prescriptive is being expanded across our network to actually all preventative care visits for children. And we are engaged in some short-term survey follow-up to assess the impact of that. The BearPower Rx for Wellness came out of many conversations between the clinic and the White Bear Lake YMCA, which is one of our key BearPower community partners and a member of the leadership team. So at the clinic level, I had seen patients for many years who needed a change. They were interested and ready for change, but they did not have a clear path to opportunities around being physically active. They were not linked to a community-based venue. We know the YMCA provides a safe, positive environment. It allows families to be active together, and it has excellent youth programming. It's strategically located within a half mile of the high school. We wanted to reduce the financial barriers for families. We wanted to provide them some support and incentives and continue to strengthen the collaboration between the YMCA and the clinic through BearPower. This RX consisted of a 3-month reduced family membership at $30 per month. The families were identified in one-on-one clinic visits, and the eligibility criteria we used was that of need, and that need could be either a parent or a child. It could be a need around a behavior change. It could be a parent that was at risk for type 2 diabetes or had hypertension. It could be a child who was at risk for the same. They did need to live in the 3 zip code area that is served by BearPower and have a desire and a readiness for the behavior change. In terms of reach, of the 34 prescriptions that have been issued, 20 families were enrolled in the 3-month membership, and 17 of those 20 completed their 3-month membership. Of those, close to 50% have continued the membership over the last year without this prescriptive. What I've found from this RX is that it is very much an individual, one-to-one clinician-family conversation. It was empowering, but because it is that one-to-one conversation, that provides a challenge in terms of creating a venue that allows for a larger number of referrals. In addition, there are barriers that exist for families in terms of cost, even with that reduced membership, and transportation. We also know that understanding utilization as a measure of behavior change is difficult. Finally, I would like to speak to the reach of a relationship within BearPower between the clinic and Solid Ground, which is a nonprofit providing transitional housing located in the White Bear Lake area. Solid Ground supports over 50 families with children in need of low-income housing. They've been in the community for over 25 years. Over 70% of the residents of Solid Ground are people of color, and over 40% of the children were aged 5 and younger in 2012. The children attend school in White Bear Lake, where BearPower is active, and many of the families seek their medical care here at the HealthPartners Clinic. So Solid Ground was already established and connected in the community. The organization has strengths in serving underserved families that could support sustainable next steps for BearPower. So in 2014, we approached the executive director and ultimately met in collaboration with the resident council. These were a series of meetings that served as listening events. They really allowed us to brainstorm ideas around wellness. The community came up with an idea because they have monthly dinners that are meant to stretch the budget. They're typically sponsored by outside groups, but they decided that they, with us in shared leadership, would create a healthy soul food community meal. So in January of 2015, we worked together and prepared a twist on the traditional soul food meal. We had a tasting the month before to convince ourselves that whole grains may work, and provided subtle changes with vegetables and fruits. And we served close to 75 residents, all families with young children. Then in the summer of 2015, Solid Ground was starting their own garden, a series of raised beds, and the White Bear Clinic staff had planted their own vegetable garden for the first time. So we as a clinic decided to donate our produce every Thursday to Solid Ground for their Thursday food giveaway, which they had already established. In this past winter, over the winter months, we met with the resident council a number of times to continue our shared leadership. We have had spirited discussions and have developed friendships and have supported each other in ideas that will help our children in the community. A number of these ideas involve a continuation of our gardens, which we are now calling sister gardens. We are both beginning our second year of growing vegetables. We have planned a Solid Ground White Bear Lake Clinic community meal later in the season using the produce from our gardens. And we are meeting with the youth to do some teaching around healthy eating, physical activity at an event actually that's taking place tomorrow. And then finally, there is great interest for a canning class that will be in the works for September. In closing, I just want to say that BearPower in the schools and community of the White Bear Lake area is intended to serve all children equally. Yet we know that socioeconomic inequities can influence both the success and the reach of BearPower programming. And using the principles of community engagement, this particular story is one of not only outreach, but listening, co-learning, and collaboration. I'll turn it back to you, Elaine.
Thank you so much, both Elsa and Marna. Both of these presentations have been just wonderful. We appreciate you sharing. And some of the lessons learned and successes and how you got there and working with the community are very consistent across these two projects, which is great for us to see. Now we're going to go to the discussion part of this program. And as a reminder, if you do have a question, some of you have been adding questions to the chat box. And to others of you, if you have a question to ask, please do include it there. And while you are thinking about that, we have 2 questions to get started. The first one is for Darcy, and that's how might clinics establish relationships with farmers without the help of university researchers?
That's a great question. And I think I want to just piggyback on a concept that Elsa and Marna put out in this idea of thinking about long-term community change. And so how do you build on the assets that exist in the community that are more likely to lead to sustainability? There are 3 places I would recommend looking. First of all, cooperative extension programming in your state. Every state has extension services, and these are, should be a first place to make a contact to learn about farmers and farmers markets in the state and opportunities for collaboration. A second opportunity would be with farmers market coalitions, farmers market manager networks, or food policy coalitions in your state. Again, if they're not the final answer for you, they could lead you to a good answer around this. And then a third place would be to connect with your state social service agency to learn more about which farmers markets in your state are already accepting SNAP, and whether if you're talking about starting a new farmers market or potentially connecting your clinic with an existing market where there's already SNAP acceptance.
Those are great ideas. Thank you so much. And then I also have a question here for Elsa and Marna, and that's what are the characteristics of a community that might make it more successful in adopting this kind of program?
Thank you, Elaine. As we've been looking at the 7 communities that we work with, we think this is an important question to continue to explore. What we've learned so far is that really, and if you look at some of the work by the Wilder Institute, there really are some measurable characteristics of the level of community engagement and readiness that communities share. So for example, some of the communities that we are working with have long histories of already collaborating and even collaborating with the healthcare system. And what we've learned is that those communities that are already accustomed to collaborating possibly on other issues, particularly related to improving health, are more ready to take on and to develop a new strategy, a new priority, and to join that shared effort. In addition, our communities range between large suburbs that are outside a large metropolitan area of Minneapolis and St. Paul, all the way into rural areas in Wisconsin and in Minnesota. We have been noticing differences in participation rates and engagement in our rural communities relative to those that are closer to the metro area. We're learning more about that. However, it does appear that right now our rural communities seem to have that community identity that really helps them take on this charge together in a really meaningful way. That's one characteristic that seems to stand out of interest. But really, it boils down to the ability of the community and the readiness of the community to collaborate, as well as how we position ourselves in that space.
Great. Thank you so much. And we have questions coming in from our listeners. This one, Darcy, is for you from Jake. For the Farmers Market project, was there any work done to assess the food environment before or after? Did the implementation of the farmers market prompt other food vendors to change at all? And did the implementation of the farmers market prompt changes in the way that people shop at other food venues? Great question.
Yeah, those are really good questions. In the current project, we did not focus on looking at the effect of this market on the broader food ecosystem, if you will. However, I do have a new study right now. We are looking at how introducing a new food retail space, or a food hub in this case, to the food environment potentially has a ripple effect on the broader food retail ecosystem. So I think it's a really good question that unfortunately we were not able to evaluate in the Right Choice for a Start project.
Yeah, that's the next project, right?
Yeah, exactly. All these projects lead you to new questions and new opportunities, and that is really a good one.
Yes, that's very exciting. So over to Marna is a question for you. When you mentioned this, the new school policy that had just passed in Stillwater, I believe, there was a question about a little more information about what the healthy school policy is.
Of course. Thanks, Elaine. We are very pleased and proud of that work together. The school policy falls under the school wellness policy in schools in the state of Minnesota. And this policy in particular focuses almost all on food and physical activity and the environment of the school. Some of the strongest aspects of this new policy are, instead of recommending to a school in the district that they encourage better food, for example, be brought into classrooms, this policy is much stronger. It actually states that food won't be used as part of classroom celebrations. Healthy food can be used educationally, but really not as an ongoing part of celebrating. This is a very big change, and part of the no food versus healthy food also came from community members who had concerns about excluding children with food allergies. And so really the no food policy seems to be the way this district wanted to approach it, and it really opens up great opportunities to improve health. The physical activity pieces include statements that are very strong about not withholding recess as a punishment for children, as well as not using physical activity in a negative way, such as doing push-ups, those kind of things. So in the conversations with the community, there's still much work to do to help parents and everyone feel really empowered by this policy, but that work has begun, and it's going very well.
Great. Thank you so much. And a follow-up question, which is, can a patient receive more than one prescription, or is it a one-time $10 fruit and vegetable prescription per patient? And is there some kind of follow-up mechanism in place to that RX?
It is one prescription per patient because this is about a conversation, and a conversation that will hopefully motivate a behavior change or a change in ideas in the home. And the follow-up happens in terms of provider survey and brief family survey. Did they use the voucher? Was there a discussion about fruits and vegetables? And because of the voucher, did the family plan to make further changes?
Great. Well, thank you so much for that clarification. And we do have other questions that we'll be able to answer online. And so sorry we've run out of time because there are some really terrific questions remaining, and apologies for that. But just to let you know again that we are keeping track of those, and they will be answered later. Now, I want to just go on to the NCCOR update section, and we're really excited about a new SNAP-Ed evaluation framework, and Darcy mentioned this in her presentation. As a result of the mandate from the Healthy Hunger-Free Kids Act of 2012, Congress mandated increased evidence-based programming and expanded the scope of program interventions. And as a result, USDA's Food and Nutrition Service developed and updated SNAP-Ed strategies and interventions in a toolkit, which many NCCOR members and state partners work together to develop. And this evaluation framework builds off of the toolkit to provide SNAP agencies a way to systematically evaluate their efforts, systematically within their own area, but also across all of the agencies involved in SNAP-Ed. So the framework includes a focus menu of outcome indicators that align with the SNAP-Ed guiding principles. Let's see, and just quickly, this image shows that the evaluation framework logic model includes focus on 4 levels of change: individual, that's children and families that participate in educational programs; environmental settings, where people eat, learn, live, play, shop, and work; sectors of influence, changes at the jurisdictional level, whether it's local, state, territorial, or tribal; and then at the population level, which is a combination of educational strategies, organizational strategies within qualified sites and settings, and changes at the jurisdictional level. The interpretive guide that goes with the framework explains the preferred methodologies and approaches for implementing the measurement of different changes. It includes a wealth of educational resources so that agencies can systematically collect evaluation data and share it with Food and Nutrition Service, other funders, and program stakeholders. And there are, by the way, with the indicators, options for different kind of measures so that an agency can choose what will work best for them. So we urge you to take a look at this. You can find it on the NCCOR website. There was just an incredible amount of work and collaboration across SNAP-Ed agencies and Food and Nutrition Service and NCCOR members to put it together. And there were a number of volunteers who wrote different chapters. And so everybody was very enthusiastic about making this available. So it's really a great piece of work. We are just about out of time. If you have any questions about NCCOR or other upcoming activities, please email the coordinating center, as you can see on the screen. That's at ncor@fhi360.org. Just before we leave, I do want to note again that all of our Connect and Explore webinars are archived for future viewing. And to access the webinars, go to the Resources tab on our homepage. And then to the from Resources, you can access the webinar series. And you can also stay connected to NCCOR by following us on Twitter and LinkedIn, visiting the NCCOR blog, and signing up for our monthly e-newsletter. I noticed that Yanni had a link in the chat room to sign up for the newsletter, or you can engage by visiting the website. So once again, I want to thank our guests, Darcy, Elsa, and Marna. Terrific programs. You really deserve a lot of recognition for these really lovely programs working with communities instead of imposing plans on them. And we also want to thank all of you who took the time to listen in today. Now, just before signing off, if you would just take a moment to complete our brief 6-question survey, your responses will help us shape future webinars so that we make the best use of your time. And we're going to shift over to that feedback form now. You can write in your input directly on the screen and hit submit